My name is Joan Snyder, Joan M. Snyder. That's how I sign things, Joan M. Snyder, because my correct name is Joan Marie. And I came to Haines in 1974 as a public health nurse. I had been a public health nurse previously in Kotzebue and in Kodiak. And I had the opportunity to move here to Haines, and so I did. At that time, the public health nurse's office was located in the building, in the basement of the building that is now the search clinic. It was much smaller then. They've just expanded on it in the past few years. And my primary job there was to take care of infants, give them immunizations, weigh and measure them, be sure they're developing properly, and also do a little women's health care, that is doing breast exams, pap smears, and just visiting families, being sure everything was coming along fine, medically and socially in these families. I visited families in town, and I would drive up the road to families along the highway and in the Mosquito Lake area. And also part of my area was Yakutat and in the summer Elfin Cove. I also went to Skagway and went to Klukwan. Now Klukwan has a health aide, Evelyn Hott. She was the health aide then. They've had several health aides since, and we worked closely together. They had a clinic over in Skagway, and I worked with a nurse over there, Polly Fleming, but they've had different people at that time.
Out of all the places you've worked, like, what town would you say would be your favorite? Like,
well, Haines, obviously, because I intended to stay 5 years. So 5 years would have been 1979, and I'm still here. Yeah, but I really enjoyed working with the Eskimo people up north in Kotzebue, but that's a very harsh environment, and I didn't think I could tolerate that for a very long time.
I also hear you're part of the women's club in Haines.
I was a member of the women's club. When I came to Haines, I met my predecessor as public health nurse, Vera Smith, and she introduced me to Lib Hakkinen. Now, Lib Hakkinen's maiden name was Sheldon, and Sheldon, the name you hear with the Sheldon Museum. And it was her father that started collecting a lot of things, so Lib's goal in life was to fulfill his dream of having a museum. So she was a member of the Women's Club, and it was the Women's Club that started fundraising for the museum, so she sort of drew me into the Women's Club. And the Women's Club, you may have heard, also was instrumental in starting the library here. So they've been known to begin about 80% of the 80 to 85% of the libraries nationwide. So the Women's Club is an international organization, not just a state organization or a national organization, but international. So the Women's Club raised money for that, but the Women's Club is not what is known as an incorporated group that can accept funds such as grants from the federal government. So one was formed, and that was the Chilkat Valley Historical Society. So they could accept grants, and through them, the museum was built in that way. And so I'm now a member of the Historical Society. I had been a member of the Women's Club for about 20, maybe 20 years, if that long. And now I've been a member of the Historical Society even longer than that.
What's your favorite memory of, like, the Women's Club? Something, like, really exciting that you guys did?
Something really exciting. Gee, I don't know. We did some neat things. I think one of them was working with Pat Jones. She's deceased now, but she was the wife of Stan Jones, who was a doctor then. And she was a very hard worker and saw a lot of things to be done. And seat belts were not in use then. And the Women's Club was very active in getting seat belts used in this town. And I worked with Pat driving up the road, wearing our seat belts, of course, and giving classes and speaking to different groups about the importance of the seat belts and how many lives they've saved and how they could be used. And so it's been very encouraging to me to see people still using seat belts. Very much.
Oh, that's cool. So you were part of the women's club and you're a health nurse. Is there a memory that you like can't forget of being like a health nurse?
Let's see. Well, I really enjoyed it. I really enjoyed it, and I retired at the age of 55, and I kind of regretted retiring that early because it was, as jobs go, a pretty good job. And I enjoyed seeing the babies, watching them grow, as I just mentioned to you, being startled at how fast they grow, and suddenly babies are parents and maybe soon grandparents. And it could be fun traveling to these other communities. For example, in the summer when I would go over to Elfin Cove in Excursion Inlet, and these were relatively healthy communities and small communities, and it was kind of fun going over there. I didn't like having to go to Yakutat because in order to go to Yakutat I was required to overnight in Juneau because Yakutat was served by a jet. So I had to stay overnight in Juneau and take the jet in the morning to go to Yakutat. And so I did that.
Why didn't you, did you like working in Yakutat?
Oh, not very much. Not very much. It was good, but not as enjoyable as the other communities. Haines I enjoyed, and of course I enjoyed watching these little well babies that I saw and gave immunizations to, watch them grow and come into school and leave school and see their parents and see how things went with them.
Did you grow up here?
No, I came here in '74. I was quite well grown by that time.
Yeah.
No, my home state is Pennsylvania, and I had quite a few experiences before I came to Alaska, which was in 1970, and that's when I first came to Kotzebue, and then later Kodiak, and then from Kodiak I transferred here.
Do you think the nursing has changed over the years, like how you nurse and like the education to get to it?
Oh yeah, it's changed very much. It's gotten much more technical, as everything has. Things have become much more technical, and many more electronic features. And I experienced that myself when I was hospitalized last year, and I could see the nurses did so many different things that weren't even known when I was in nursing 50 years before.
Mm.
But it still takes a special person to tolerate the atmosphere of a hospital or nursing.
What was your most exciting event that happened in public health in Haines?
Most exciting event, gee, I don't know. I think, well, there were a couple things. I had to attend a birth, but babies have a way of delivering themselves, so that was not a great big deal, but it came off fine. And another thing was a man was injured. He got a big gash on his leg, and I didn't have the equipment to sew it up, but I was able to tape it, what we call a butterfly bandage, and I was able to see that and when it healed, and it healed up very nicely, but this was a very young man. But I think the nicest part of public health is watching the children grow, seeing people's health improve generally, and I noticed that very much down here when I came here and worked in Cluck-One especially. But there were other factors besides just public health nursing that helped with that. I think one of the biggest things that helped with that was the permanent fund dividend, so it gave people more money to buy better food and have better attention medically.
Did you face any threats being a health nurse?
Not really, no. I was pretty well respected just about wherever I went. I had nothing to fear, I felt.
What change have you witnessed in Haines over the years?
Oh, lots of changes, lots and lots of changes. As I said, the general health of children has improved greatly. People have become much more aware of health. health problems, how to care for themselves, nutrition, and that's not just from the public health nurse, but from other factors. Generally, the news media have promoted this, and we have many other healthcare workers here. We have, I think we have 2 mental health clinics now. We have, I shouldn't say that, we have a state-run mental health clinic, and also we have someone in private practice. We have a full clinic. We only had a private, one doctor in private practice with 2 or 3 nurses. Now we have a full clinic with several doctors, and then we have 2 other doctors in private practice. So we have a lot more providers, although they tell me the population of the town has decreased. It seems there's a lot more here for people. And besides the health field, there are a lot more cultural things here for people. The museum, of course, was the first big thing, and then the library has continued to grow, and then the Eagle Foundation, and then the improvement of the Chilkat Center. This is all these things help to improve the general health, mental health of people in the community.
How long has the Women's Club been a club?
This club here, I think, was started in 1918. I'm not sure how long the General Federation of the Women's Club has been in existence, but this Lib Hakkinen, that you've heard talk about so much, she and her mother were both members of it, and so that's why the club was ready to back her in her looking for fundraising efforts from a group.
Have you gone anywhere in like the world besides the United States?
Well, as I said, I was a Peace Corps volunteer in Afghanistan and in India for 2 years, and I've traveled to Europe several times, and I had a tour to China several years ago with a group of nurses. That was interesting. Also a tour through Russia with a group of nurses, and those trips are more interesting than the average trips because you get to see somewhat of the underside of the culture. Like we got into communes in were they call them communes in China, and in Russia we got to see some a facility for old people, and that was in the communist era, and they were very proud to be able to provide facilities for old people and a house or dwelling for everyone. But in a room small, about a third of it, about 3/4 of this size, they would have 3 beds, and they were just cot-sized beds. And the people just really didn't have room to move around. But they were cared for, and they did have food. But it was so far behind what we had, so I was able to see a lot of that.
What do you think the difference would be health-wise between here and Afghanistan?
Oh my, a world away. You know, the West is so different from the East. And when I was in Afghanistan in 1964, and I have no reason to think that it's changed very much since, the health care there was about what it was 50 years before then in the United States. And for example, at the time after women delivered, and I worked in a maternity hospital, and after women delivered, they put them in bed and tucked them in very tightly because that was their pride and joy, keeping a nice, tidy looking bed, and wouldn't let them get out of bed. Well, you know, we have learned that that is not the thing to do, that you have to get people moving around quite early after surgery or after delivery. And they did not have, maybe it's changed a bit now, but in the 60s, what am I talking, 50 years ago? Almost 50 years ago. They did not have appliances, electric appliances in the hospital. The maids, the nanas as we call them, had to wash the sheets, the bed sheets, and the linens that people wore by hand. and they didn't like a scrubbing board, they just scrubbed them with their knuckles. And then they just hung these sheets out on the line to dry. They didn't have electric dryers. So it was pretty primitive, even though they thought that was pretty modern.
Did you influence any of them by any chance? Like, not just Afghanistan, but like everywhere you went?
Well, I would like to think I did. One thing I did in the hospital there was set up a supply room. They didn't have that. And hospitals, this is before the age of commercially prepared trays and all that sort of thing. And I taught them how to set up trays and roll bandages and sterilize the equipment.
Well, that's good.
My name is Doris Ward, and I was a teacher here in the school for 10 years.